Hello everyone. So this will be the continuation of our topic last week, which is the intestinal nematode. So first, let's have Trichuris trichuria. So Trichuris trichuria is also called as the whipworm. So from the word itself, whip, it resembles the handle of a whip. So actually 71 ang species na recorded sa Trichuris, but the human infection kay mostly na confide sa kaning Trichuris trichuria. So for its habitat, it resides in the large intestine, mainly of man, and it is mainly found in the cecum. It is attached in the cecum, and others are found in the appendix, colon, and the anal canal. So, more siya, cecum and appendix sa large intestine. So, for the morphology of the adult worm, it is whip shape. Anterior 3/5 is thin, hair-like, and coiled, like a rope of a whip. So, mani siya sa male, ang anterior portion, thin and coiled, and also for the female, thin and coiled. So the coiled anterior part contains the like the esophagus, muna na siya, and the posterior part, which is short and thick, muna ni siya ang short posterior part nila diri. Ara na makita ang reproductive organs or the genital organs, ang intestine, dira siya makitaan. So the male worm of Trichuris trichuria is whitish, 30 to 40 mm, slightly shorter than the female, and the male has a coiled posterior end with a single spicule and a retractile sheath. So mao ni siya ang coiled posterior portion or end sa male. And for the female, it is longer. Again, always not long ang female worm kaysa sa male worm. So it's 35 to 50 mm long, and it has a bluntly rounded posterior end. So mo na siya diri. Again, bluntly rounded posterior end, and it's either shaped like a comma or an arc. So mo na ni siya. So female lays approximately 14,000 to 20,000 eggs a day. For the egg, Trichuris trichuria eggs measures 50 to 54 UM long by 22 to 23 UM wide. They are barrel shape, lemon shape, foot barrel shape, lemon shape, football shape, aka the Japanese lantern ova. Gitawag siya Japanese lantern ova. So it is surrounded by a shape. It has a plug-like translucent polar prominences, yellowish outer and transparent inner shell. So it bears protruded mucous bipolar plugs in both poles. Mo ni siya ang bipolar plugs sa Trichuris trichuria. So eggs are unembryonated when firstly passed, and again it's bile stained yellowish in color and unsegmented when laid. So these are oviparous. So again, they have mucoid bipolar plugs with barrel or lemon sheath, thick shell, and clear plug at the end. So usually the egg has 4 layers. So we have the VCAB, the vitelline membrane, the chorionic or the true shell, the albuminous covering, and lastly the bile stained layer. Okay, so for the life cycle, the host, humans are the only host. Kani men, humans, men. So ang diagnostic stage, ang first nagilay, which are the unembryonated eggs. So makita dere mo ni siya ang diagnostic stage, unembryonated eggs pass in the feces, and the infected form, the embryonated eggs. So modes of transmission, man, usually children, acquire the infection by ingestion of contaminated food and water containing the infective stage, which is the embryonated egg. So mo ni siya ang life cycle. Unembryonated eggs pass in the feces, and then ayun lang ta. So first, we have the egg larva adult transformation. So ang eggs mo hatch out sa intestine, releasing the second stage larva, and then migrate to the large intestine where they undergo further moltings to transform into adults. And the female worms, following fertilization, start laying unembryonated eggs within 2 to 3 months. So each female again can lay 14,000 to 20,000 eggs per day. So right after aray na ta sa embryonation, the unembryonated eggs, which are the diagnostic stage, passed in the feces, are not infective. Diagnostic ra siya, dili siya infective. It takes about 28 days to become embryonated. So it undergoes 2 molts to produce the second stage larva. So ang embryonated man ni siya, maari ni siya sa soil hantod ma-embryonated siya na egg. So ang iyahang require sa embryonation kay need siya og moist conditions and 25 degrees Celsius na warmth, and then such embryonated eggs mao na ni siya ang infective sa man, and then acquires infection by ingestion of contaminated food and water containing the embryonated egg. Then larva is liberated through one of the pole of the egg. So, di ba, non-operculated ang atuang nematodes, pero naa sila, like for example sa Trichuris, naa siya poles, may nga bipolar plugs, niya ara mo gawas ang larvae. And then second stage of larvae na pod, then mauna na siya ang cycle mo repeat. So for the pathogenicity and clinical features, most infected individuals have no symptoms or only have eosinophilia. Those with more than 2,000 eggs of feces often develop severe diarrhea or dysenteric syndrome. So incubation period varies from 70 to 90 days. So in people with heavy infections, adult female worms get buried in the large intestinal mucosa that leads to one mechanical distortion, like leading to inflamed, edematous, and febrile mucosa, allergic response to the host, and common manifestations, which includes abdominal pain, anorexia, etc. We also have trichuris dysentery syndrome, which is a bloody or mucoid na diarrhea. Resembling inflammatory bowel diseases, and iron deficiency, also anemia due to blood loss. So we also have recurrent rectal prolapse. So this is due to the heavy worm load in the rectum and malnutrition. So meaning mura siya mugawas. Mauni siya. Rectal prolapse. And lastly, growth retardation and impaired cognitive function due to the release of anti-inflammatory cytokines induced by the secretory molecules of the species, the Trichuris species. For the laboratory diagnosis, we have first DFS, the direct fecal smear. So because the level of egg output is high, so microscopic examination of a single fecal smear is sufficient for the diagnosis. So ang imo lang pangitaon if mag DFS kay ang characteristics sa katong barrel-shaped trichuris eggs with mucus plugs, and ma-detect ra ni siya nimo by wet mount or concentration techniques. For example, another example kay ang Cato cellophane thick smear, which involves spreading a large amount of stool on a slide and then i-cover siya with glycerol soap na cellophane strip. And then also natay Cato cuts technique, the quantitative method, meaning mag-measure og egg counts per gram. So ang stool i-press siya sa isa ka mold fixed in size niya, place siya sa slide niya, i-clear japon siya sa glycerol soap na cellophane. And lastly, the acid ether formalin ether concentration method. So ang nahitabuan ni kay mag concentration method siya in which ang stool i-emulsify siya sa formalin or acid mixed with ether and icentrifuge siya. So ang Hellman eggs kay ma-concentrated siya ato siya mapunta sa sediments. So for the treatment, we have albendazole, mebendazole. So albendazole 400 milligrams daily for 3 days, for 3 doses. Mebendazole 500 mg once. So mo ni siya ang treatment, first line na treatment sa Trichuris trichuria. So this is safe and moderately effective for treatment. Also, we have ivermectin. Pwede ra pod siya. 200 mg daily for 3 doses. All safe pod ni siya pero less effective ni siya. So mas effective ang albendazole, mebendazole. For the prevention and control, treatment of infected individuals, sanitary disposal of human species, di lang bisag asa ilabay, washing of hands with soap and water, especially before magkaon, health education, and thorough washing and scalding of uncooked vegetables. So that's it for our Trichuris trichuria. Now let's proceed to the next. We have Capillaria philippinensis. If naka-remember pa mo, Capillaria and Trichuris belong to the same family, Trichuridae. So their eggs are morphologically similar, and that's why they are often get confused. And from the word itself, sa iyahang name, sa iyahang parasite name, Capillaria philippinensis, this parasite was first reported from the Philippines. and it is widespread in the Philippines and northern Luzon area. It is a tiny nematode residing in the small intestine. So, for its morphology, the adult worm, similar to Trichuris, since again they belong to the same family Trichuridae, except that it is a smaller whipworm. So it has a thin filamentous interior end and a slightly thicker, shorter posterior end. And the male is 2.3 to 3.17 mm and female is 2.5 to 4.3 mm. Male spicule is 230 to 300 long and has a spine sheath. For the egg, it also resembles the Trichuris eggs, except their shape is peanut-shaped eggs, less barrel shape. Kaya di ba barrel shape man to ang sa Trichuris. And also they have flattened bipolar plugs. Ang sa dili siya same sa Trichuria na mo protrude jud ang iyahang bipolar plug. So same sila, nakasalay mucus plug, present ilang mucus plug, pero less prominent siya compared sa Trichuris. So these are also smaller, 36 to 45 long by 20 wide, surrounded by a striated thick shell. So for the life cycle, there are two types of hosts. The definitive host, the fish-eating birds, or are muna siya ang natural definitive host, and the reservoir of the infection. And also humans acts as the accidental definitive host. And the intermediate host is a fresh or saltwater fish containing the larva. So muna siya ang infective stage. And the diagnostic stage, then unembryonated eggs. So mode of transmission, ang humans maka-acquire sa infection by ingestion of undercooked or pickled kinilaw na isda containing the infected larvae. Infected larvae. So, ang development of fish. So, embryonated eggs. Unembryonated eggs pass from the feces and then eggs become embryonated in water. So, mo ni siya ang infective form sa fishes. So, following ingestion of the eggs in the intestine of the fishes, hatch out into larval forms which are infective to the man or the birds. Same rin siya ang cycle sa man ug ang birds. Kay mukaon man ta og fish ang man, ang birds pud mukaon sa fish, like fish eating birds katong gitawag. And then for the development in man or in birds, the larvae mature into adult worms in 10-11 days and live and burrowed into the mucosa of the small intestine. So, ang adult worms mag-lay o fertilize. Ang adult worms fertilize niya, maka-lay siya, fertilization occurs, maka-lay siya og two types of egg, ang embryonated egg na mapas sa feces, mo ni siya, or ang embryonated eggs lacking shell na mo hatch inside the definitive host. Mo ni siya ang gitawag na auto-infective na cycle. So, kay ang some of the eggs, as I mentioned, mahimor siyang embryonated sa intestine. And then, mo develop into larval stage, makakause og auto-infection. Ang some sa iyang eggs mapasra sa feces. And then, ang cycle mo continue ra. Same ra gihapon ang cycle. For the pathogenesis and clinical features or manifestation, the clinical disease consists of abdominal pain, gurgling stomach, known as burborygmi, malabsorption syndrome with severe diarrhea. It also causes weight loss, malaise, anorexia, vomiting, and edema. And mild to moderate worm load causes non-specific abdominal pain and watery diarrhea. Severe, ang mild to moderate ni siya na worm load. Ang severe worm load can cause intestinal inflammation, loss of villi, crypt proliferation, and eosinophilic granuloma. This lead to severe malabsorption that in turn can cause protein losing enteropathy and severe weight loss or the weight gain syndrome. So autoinfection is responsible for maintaining the worm load, and sometimes heavy worm load can cause super infection syndrome. For the laboratory diagnosis, so by the finding the characteristics of eggs in DFS, direct fecal smear. So katong characteristics sa peanut-shaped egg sa stool examination. Also, the adult worms of Capillaria philippinensis reside and lay eggs in the mucosa of the small intestine, particularly the duodenum. This explains why duodenal aspiration can be used as a part of the diagnostic process. For the treatment, we have albendazole, 200 mg twice daily for 10 days. And also we have mebendazole. For severely ill patients, it requires fluid replacement and support therapy. For the prevention and control, avoid eating raw fish, good sanitary practices, proper waste disposal, and again, educational programs. Next, we have the Enterobius vermicularis. So, Enterobius vermicularis is also called as the pinworm or seatworm. So, it causes enterobiasis or oxyuriasis characterized by perianal itching or pruritus ani. So, it was formerly known as Oxyuris vermicularis. That's why ang iyahang infection makakos og enterobiasis, enterobius, or oxyuriasis. Kay gitawag man siyang Oxyuris vermicularis sa una. So, its habitat, the adult worms remains attached in the large intestine. Then, the cecum, appendix, and the adjacent portion of the colon. For the morphology, the adult worm is small, white, and tetic. For the female adult worm, it is longer, 8 to 13 mm long by 0.3 to 0.5 mm wide. It has prominent esophageal bulb and long pointed tail. And the posterior one is tapering straight, thin, and pointed. It looks like a pin, hence called as the pinworm. So, again, ang kanisya na worm kay oviparous. Oviparous. Meaning maglay og egg, and then it takes time na ma-turn into larvae. So, muna siya ang female. So, makita nimo ang pointed end. For the male, it is 2 to 5 mm long by 0.1 to 0.2 mm wide. It is smaller than the female worm, and the posterior one-third is tightly curved and bears a cupulatory bursa with spicules at the posterior end. So, kita niyo curved ang iyahang tail. Then, so, ang kaning male kay mamatay ni siya after fertilization or copulation. So, next, we have the larva. The rhabditiform larva is 140 to 150 UM by 10 UM in size. Sa ilang eggs kay asymmetrical, it is D-shaped, oval, or plano-convex. Kay ang one side kay flattened and the other side is convex. So, more siya D shape. And it is 50 to 60 UM long by 20 to 30 UM wide. And a single female lays 2,000 eggs per day. So again, it is oval in shape, surrounded by a double-layered eggshell, which is relatively thick, though transparent. So, mo ni siya diri dapita. So, kani. So, it also has an outer albuminous layer. Mo ni siya ang responsible na ang eggs kay mo stick to each other and also sa clothing and others objects. So, ang eggs kay embryonated when past fresh contains a tadpole shape called embryo, which is fully formed but becomes infections only 6 hours after being deposited in the skin. So, muna na siya. For the life cycle, humans are the only host, and the embryonated egg is the infective stage. So, ang diagnostic stage na to kay ang egg sa perianal folds, and infective stage kay embryonated eggs. So, mode of transmission, usually men, usually children, acquire infection by ingestion of embryonated eggs containing the larvae. By ingestion of eggs contaminated with fingers due to walay tarong na paghunaw or ang nail biting the habit. So also, naapod siya auto-infection. And there are two. We have the auto-infection, ang endogenous, ang exogenous first kay ingestion of eggs due to scratching sa perineal area, then ang fingers na under the nails na ay eggs, and then imong makita yun sa tao. Mao ni siya ang infection na most commonly sa children. So this mode of infection occurs from anus to mouth, fecal-oral. And then we have the endogenous infection, auto-infection, or the retro-infection. So in this process, ang eggs na nalaid sa perianal skin, infection, ang eggs na nalay sa perianal skin, mo immediately ma-hatch into the infective larva, bisag na pa siya dira. Then mo migrate siya to the anus and then to the colon. So this mode of infection occurs from anus to colon. So this is what we call as retro-infection. So ang kani same ra ni siya. Let's proceed to the pathogenicity and clinical features. So asymptomatic, most infections are asymptomatic. and also naatay symptomatic patients. Age and sex, females, children, and young adults are often symptomatic. Mo ni siya ang atong symptomatic patients than males and older people. For another, kay ang kaning irritation sa perianal region kay ari man mo lay og eggs ang ato ang female adult worm, and intense itching. So na ang worm mag-produce og intense irritation and pruritus on the perianal skin, the perianal area, called as pruritus ani. Once mo crawl ang female worm na malay og egg sa anus. This leads to scratching. Also, we have insomnia due to pruritus. Di kakatul, tarong ugtog kay tungod sa kakatul. Kay makadisturb man siya sa sleep. Ig-migrate sa worm ig kagabi. And also na ang also nocturnal enuresis or bedwetting is sometimes seen. So also we have poor appetite, weight loss, irritability, grinding of teeth, and abdominal pain. For the diagnosis, eggs are present in the feces only in the small proportion. So feces examination is not a usual diagnosis since the female worms lay eggs in the perianal area, dili sa rectum. So they are deposited in large amount of numbers sa perianal skin ikagabi and can be demonstrated in swabs collected early in the morning before ang tao moadto sa toilet or maligo. So swabs from the perianal folds are most often positive, and also eggs may be demonstrated sa hugaw na naa sa fingernail. So first we have microscopy. The perianal swab collected by cellophane tape method or the Scotch tape method or the NIH swab methods. Moto na to ma-detect ang panoconvict eggs containing the larvae. So ang kani siya, ang eggs na deposit sa perianal skin ma-collect by applying katong cellophane tape or its Scotch tape method or its modification called the NIH swab method. So again, mo ni siya best method sa recuperation or recovery sa eggs, and reporting should be done early in the morning before nalibang, before maligo, before manghinlo ang patient or ang tao. Also, this can be obtained late at night. So, a drop of toluene or xylene may be placed between the tape and the slide. Mo ni siya ang nag-serve as clearing agent para ma-enhance ang vision sa parasite. Ma-reduce ang distortion na nakos sa tape. So, mo ni siya. So ang kaning atong E. vermicularis gitawag pud ini siya og society or societal worm. Society or social worm. Kay highly infectious man siya. If isa ka member sa household na infected, everyone na naa sa panibalay kay dapat jud treat. So, ang ruling out, at least 5 consecutive negative specimens are required para ma-rule out ang infection. And ang modification niya kay ang NIH swab method. Sa Scotch tape method, di ba, lahos raman ni siya papilit sa perianal area. Ang sa NIH swab method kay naa siya glass rod, and then attached to it is a cellophane tape, and then ikuan siya og cellophane tape, i-wrap siya og rubber band, and the end sa glass rod kay naa siya rubber stopper and in a test tube. So ang kaning cellophane part sa glass rod, kuhaon ni siya ang kaning cellophane part sa glass rod, i-roll ni siya sa perianal or skin para ma-collect ang sample. And then after kay i-transfer din siya sa slide, and the examination to detect the interobvious eggs, which are again plano-convex, flattened along the side, D-shape, measures 50 to 60 UM by 20 to 30 UM, containing larvae inside. So, adult female worms may occasionally be found in the feces or crawling to the perianal skin ang adult female worms, and ang male worms kay dili gyud ni siya magkit-an kay mamatay man siya after copulation or mating. For the treatment, one of the following drugs can be given. We have albendazole 400 mg once, mebendazole 100 mg once, or parental pomoate 11 mg kg once. So the same treatment should be repeated after 2 weeks. And again, treatment of the household members is associated to eliminate asymptomatic reservoir of potential reinfection. Prevention and control, again, personal hygiene, proper hand washing para makuha ang mga nanuksok sa nails na basig na ay eggs diha nanuksok. And lastly, infected person should sleep alone kay basin makatakod. So now, ari na ta sa Ascaris lumbricoides. So it is the largest nematodes parasitizing the human intestine, and the name largest is derived from Ascaris, meaning intestinal worm, and lumbricus means resembling with common earthworm. So it is commonly called as the roundworm, which normally is located in the small intestine. So 85% naa sa jejunum, and 15% naa sa ileum. So again, Ascaris lumbricoides is the largest nematode parasite in the human intestine. So for the morphology of the adult worms, they are large cylindrical worms with tapering ends. So it has a thick cuticle, and the anterior end being more pointed than the posterior end. So it is pinkish creamy to white in color, pinkish creamy in color when freshly passed from the intestine, but gradually fades its color and look whitish outside the body. And it has 3 lips with a minute or denticles. For the female worm, it measures 20 to 35 cm long and is 3 to 6 mm wide, and are longer than the male worms, which are smaller, 15 to 31 cm long and 2 to 4 mm wide, and has a curved tail. So male, its posterior end is curved ventrally to form a hook and carries 2 copulatory spicules or two broad spicules. This is necessary for copulation or mating. For the female, posterior end is straight and pointed. Ang posterior end sa male kay curved man to. Ang sa female kay pointed. Vulva opens at the junction of the anterior and the middle thirds of the body. The portion of the worm is narrower and a single worm lays up to 200,000 eggs per day per female na niha, and eggs are passed in the species. So for the eggs, there are two types of eggs liberated by the female adult worm. The fertilized egg, which is brownish ovoid, measures 50 to 70 by 40 to 50 UM, and the unfertilized eggs, which measures 90 to 45 UM. So, ang fertilized eggs laid by the females inseminated by mating with the male are embryonated and develop into infective stages. So these are shorter and broad or round. These have thick shell regulated by regular mammillated coating or mammillated coat with mammillated coat. Ang kaning mammillated coat made up of albumins and proteins. So this provides protection to the egg. So sometimes fertilized eggs may lose the thick mammillated albuminous coat or the shell, and such types of eggs are called as the decorticated eggs. Next, we have the unfertilized eggs. Again, it measures 90 to 45 UM and laid uninseminated. There are non-embryonated and cannot become infective. So, unfertilized eggs are longer and narrower or elongated. And the shell of mammillated coating is thin and irregular. So the larva may be seen in the lungs and may measure up to 2 mm long and 75 UM in diameter. So I don't know if naka-remember ba mo, but nakakoy gi-mention ato sa first pa lang dyan sa introduction to parasitology na natay gitawag na parasites na undergo heart to lung migration. We have the ash, the ascaris, muna ni siyang ascaris lumbricoides, the strongyloides stercoralis, and the hookworms. Muna ang larva, masin siya sa lungs. So these are the eggs of Ascaris lumbricoides, the unfertilized eggs with mammillated layer. The unfertilized egg, decorticated egg, na wala na yung mammillated layer. We have the fertilized egg and the larva hatching from the egg. So this table, we have the differences between the fertilized and unfertilized eggs of the Ascaris species. For the egg, for the shape, round to oval, fertilized, unfertilized, elongated, and then the size, its size and covering thick mammillated. For the unfertilized, we have thin and irregular, and so on. So please remember this table. And here we have the life cycle. Again, the infective stage. We have and the diagnostic stage. So here. So for the host, it only involves one, which is the man, and the infective stage, the embryonated stage. Embryonated. Eggs, di ay. Eggs. If pangutan-on sa infective stage, embryonated eggs. If pangutan-on, particularly the L2 larvae. So mode of transmission, infection occurs when the egg containing the infective stage is swallowed. And frequent mode of transmission also is through the fresh vegetable grown in the fields manured with human feces. So basically, infection may also be transmitted sa contaminated drinking water. So basically, ang MOT, modes of transmission, ingestion of embryonated eggs, and from the contaminated soil, food, and water. So here we have the life cycle. Arita mag-start sa migratory phase. So following ingestion, the eggs are out to liberate in the L2 larvae in the duodenum. Siya sa duodenum. Muna ni siya. Then the L2 larvae molt once, may muna siyang L3, mo penetrate sa intestinal wall, sa intestine. Sa right side ni siya sa heart, have via pulsal circulation. And then finally enters the lungs via pulmonary capillaries within 6 to 10 days sa lungs. And then the larvae mature and molt to form the next stage or the L4, and then larvae breaks into the alveoli, migrates into the bronchi, the trachea and pharynx, and then finally swallowed to reach the intestine. For the intestinal phase, larvae undergo the final molt and develop into adult worms in the small intestine, and adults become sexually mature, fertilize, and the female worm starts laying fertilized eggs, which are passed in the feces, and sometimes before mating, the female worms directly lay unfertilized eggs. So, mo ni siya ang fertilized decorticated egg, unfertilized egg, decorticated egg. So, natang gitawag na pre-patent period, mo ni siya ang time sa egg ingestion hangtod sa egg passage sa feces, and it's around 8 to 12 weeks. So, arin na ta sa development in soil. The fertilized eggs become embryonated 10 to 14 days under suitable conditions such as warm clay or ang humidity or ang temperature. And the rhabditiform L1 are produced inside the eggs, which then molt to produce the L2 larvae. So, mauna na siya. And then, mauna to siya. Ma-acquire ang infection by ingestion sa contaminated na soil, food, or water containing the embryonated egg. So, for the pathogenesis, asymptomatic. Most people with the mild Ascaris infections are asymptomatic. We also have malnutrition and growth retardation, kay mangawat og nutrition ang parasite sa host muna makakause og chronic malnutrition and growth retardation sa children, and also allergic manifestations like fever, urticaria, neurotic edema, and conjunctivitis may occur due to the toxic fluid ang katong ascaron or ascaris release sa adult worm. So kaning ascaron or ascaris kay mo ni siya naani siya sa body cavity. So naa siya ang body cavity filled siya og fluid na mo ni siya ascaron and ascaris, in which ang intestine og ang genital organs kay mo float. So ang kani siya kay na fluid kay irritant kay ni siya na if mulik ni siya makakause ni siya og mga allergic manifestations mo na ni siya ang fever, urticaria, ang neurotic edema, and conjunctivitis. So we also have larval migrations may cause pneumonitis and bronchospasms. Also, common symptoms include a non-productive cough, chest discomfort, and fever. And also, in severe cases, patients develop dyspnea and transient patchy infiltrates seen on the X-ray, along with the peripheral eosinophilia called as eosinophilic pneumonia or Loeffler syndrome. So for also in the intestinal complication, a large bolus or bolus formation of entangled worms can cause acute pain sa abdomen due to the obstruction sa worms. And also, we have the ectopic migration in the appendix, bile duct, and pancreatic duct. For the laboratory diagnosis, we have the detection of parasite eggs, both fertilized and unfertilized eggs can be detected by stool examination using saline and iodine wet mouth. For the detection of the parasite or adult worm detection, we have the barrier meal examination. So, occasionally, ang kaning adult worms kay ma-detect sa stool or sputum sa patients. So, ang kaning barrier meal examination sa X-ray sa GIT kay makademonstrate sa adult worm sa intestine. So, mo po na siya use also ang ultrasound ma-use po ni siya, and also larval detection in sputum or gastric aspirate. Kay again, makita ni siya sa mo-migrate ni siya. And then during the early pulmonary migratory phase mo to siya ang larvae ma-found sa sputum or sa gastric aspirates before siya ma-appear sa stool. Also, we have the serology antibody test detection. We have ELISA, indirect fluorescent antibody test, and indirect hemagglutination tests. So, ang katong concentration techniques by sedimentation method should be done if direct stool microscopy kay kani siya kay negative. Flotation method for stool concentration kay dili siya preferred. Ang concentration techniques ra kay ang unfertilized eggs kay dili siya mo lutaw sa saturated salt solution. So for the treatment, we have the administration of antiparasitic or antihelminthic drugs. So ascariasis should always be treated early to prevent potentially serious complications. So we have mebendazole, 100 g or 2 times a day for 3 days. We have albendazole, a single dose of 400 mg once is also effective. And we have also parental pomoate, single dose of 10 mg per kg of body weight. So kani siya kay safe ni siya sa pregnancy. So also pwede po ang alternate drugs na gamiton ang ivermectin. So for the treatment, muna siya, administration of antihelminthic drugs. For the prevention and control, we have mass chemotherapy, environmental sanitation, improvements in housing, eating cooked food, proper hand washing, and good personal hygiene. Next, Arinata sa Strongyloides stercularis. Strongyloides stercularis is also known as the military worm. So it is characterized by the free-living, rhabditiform, and the parasitic filariform stages. So ang kaning free-living rhabditiform kay female worms na multiply sa environment, and the parasitic filariform stages na ang female worms na reside sa human intestine, particularly duodenum and jejunum. So this is the smallest nematode to cause human infections. Kani siya ang smallest nematode na makakause og human infection, and then ang largest nematode na makakause og human infection kay ang Ascaris. So for the morphology, so only female worms are seen in the human intestine. Ang male worms makitaan pero rarely lang. So the parasitic female worm in the human intestine measures 2 to 3 mm long and 30 to 50 broad, colorless, semi-transparent with finely striated cuticle. It has a slender tapering anterior end and a short conical pointed tail. The uteri contains a single file of 8 to 12 thin-shelled transparent ova, 50 to 58 by 30 to 34 So, mo ni siya ang female reproductive organs sa female worm. So, the rhabditiform free-living female worm is smaller and thicker. Smaller and thicker than the filariform or parasitic form. So, the rhabditiform male worm is smaller or shorter and broader than the female. It measures 0.6 to 1 mm in length and 40 to 50 mm in width, smaller and broader than the female. So it has ventrally curved tail and 2 copulatory spicules. So mo ni siya ang mo penetrate sa female during copulation. For the larva, we have 4 stages of larva, the L1 and L4. The first stage is the rhabditiform larva or the feeding form. Eggs hatch out to form the L1 larvae in the human intestine, and they measures 250 UM by 16 UM with it has double bulb esophagus and prominent and large genital primordium. They have a shorter buccal capsule or buccal cavity, and it is the diagnostic form sa parasite. Diagnostic form. Makita ni sa human feces. Next is the third stage of larva or the infective form of larva, which is the L3, kani siya L1. It is the non-feeding form. Non-feeding form. In the environment, the L1 larva molts twice. Kaduha siya mo molt and then mo form sa L3. So it is slender, measures 630 UM to 16 UM width that bears a long cylindrical esophagus and a notched tail. So it survives few days in the environment, and it is the infective stage to human. So the male measures sa ilan ni larvae 0.9 mm in length, and the female is 2.0 to 2.5 mm. So mo ni siya. Muna ang adult male, muna ang spicules, and then the female male. And then, mauni siya ang filariform larva and the rhabditiform larva. So, ang kaning hookworm and the strongyloides, ang hookworm ato ni siyang matakol in a while. Pero ang ilang larvae kay indistinguishable siya. Kani sila duha indistinguishable, pero naay parts na makadistinguish gud sa ilaha. So mo ni siya ang differences sa ilang filariform larva. Ang hookworm mas taas, pero sa size parang esophagus niya kay shorter, ang strongyloides mas taas, and then until kay pointed ang sa hookworm, ang strongyloides kay blunt and notched. So we have here the eggs have a clear thin shell and are oval. It measures 50 to 70 UM long. Eggs of Strongyloides circularis are ovoviviparous, meaning they immediately hatch out to larvae. Thus, it is the larvae or larva na ma-excrete sa feces and detected sa stool examination, dili ang egg. So, as soon as the female worm lay embryonated eggs, they hatch out to form rhabditiform larvae, the first stage of larva. And the rhabditiform larva then develops into a filariform larva. Undergo ito siya into two molts, which are the infective or are infective to humans. For the life cycle, so ang Strongyloides circularis involves only one host, which is the man, and rarely ang domestic pets. So, infective stage kay ang L3, filariform larvae. And the diagnostic stage kay ang rhabditiform larvae. Modes of transmission: penetration of skin by the L3 larvae or by walking barefoot. Larva releases then hydrolytic enzymes that helps sa ilahang penetration. So, it has also autoinfection, internal autoinfection. So, here we have the life cycle. So, first, arita sa migratory phase. So, following penetration, man gets infection by penetration of the filariform larvae. It enters the subcutaneous small venules to the venous circulation, and then reach to the right side of the heart, finally to the lungs. Here they enter into the alveolar space, migrates up to the bronchi, the trachea, and then maswallowed sa sputum, and they enter the GIT. For the intestinal phase, kay ang L3 larvae would undergo into third molt, mostly in the lungs up on or reaching sa esophagus to form the L4 larvae that reach in the small intestine where they undergo to the final molt na mahimo siya og adult female worms. However, adult males are not found in the human intestine. So the laying eggs, only the female worms are seen buried in the intestinal mucosa, which can directly makalay sila og eggs without fertilization. Ang gitawag ani kay parthenogenesis. So mo ni siya ang process by which the females produce offsprings without fertilizations by the males. So eggs soon hatch out, liberating the rhabditiform L1 into the intestinal lumen and are passed into the feces. And then we have the auto-infection. Sometimes, ang kaning L1 larvae na di-release sa human intestine, dili siya mapas sa species. But mo develop siya into filariform larvae, and eventually mukalit lang siya o penetrate sa intestinal wall, sa perianal skin, and then mo enter sa venous circulation, and then mo reach sa lungs. So mo ni siya ang auto-infection, mo ni siya ang responsible for maintaining the infection as long as 30 to 40 years and can cause disseminated infection kay tungod mo balik-balik lang siya. So, development sa environment in moist or warm soil, ang kaning rhabditiform larvae kay mo molts twice, mahimo siyang L3 larvae. And then the two developments takes place, the direct and indirect na development depending on the environmental condition. So, ang direct development, ang kaning L3 larvae kay act as the infective form, di ba? And infects the man through the penetration of the skin. Lahos na ni siya. Sa indirect development kay L3 larvae, molt siya og twice. Mahimo siyang adult worms, male and female, in the environment, and the free-living adult worms become sexually matured, fertilization takes place to lay eggs and hatch out into L1, and then molt og twice to form the infective form na filariform larva in soil, and then the cycle repeats. So pathogenesis or clinical manifestation, rashes. Some people develop recurrent maculopapular or urticarial rashes. That involves primarily the buttocks, perineum, and the thighs. Cutaneous larva migrans. Migrating larvae may produce the pathognomonic serpiginous urticarial rash called as the larva currenso. Pulmonary symptoms are uncommon compared to ascariasis and hookworms. It occurs only secondary to underlying disease. Also, we have the effect due to the worm and filariform larva. We have bronchopneumonia, which may be present and which may be progressed to chorionic bronchitis and asthmatic symptoms in some patients. So, larva of strongyloides may be found in the sputum of these patients na naay bronchopneumonia. We have the mild to moderate worm load. Adult worms and larvae transversing at the upper small bowel mucosa may produce epigastric pain, resembling peptic ulcer, nausea, diarrhea, and blood loss. We have the heavy larval workload, the hyperinfection syndrome, which are disseminated troglodytosis and are important complications. So, ang kaning hyperinfection syndrome kay debilitated individuals and or particularly those with cellular immune disease, extensive internal reinfection takes place, leading to enormous number of adult worms in the intestines, lungs, and larvae in various tissues and organs. So, muna gitawag na hyperinfection syndrome. So, during hyperinfection, ang filariform larva may enter sa arterial circulation and lodge sa various organs such as the lungs, kidney, pancreas, heart, liver, and lymph nodes. So, mo siya ang hyperinfections. So, we have here 3 light infections does not cause intestinal symptoms, moderate infections, diarrhea alternating with constipation, and heavy infections, intractable, painless, intermittent diarrhea or Cochin China diarrhea, characterized by numerous episodes of watery and bloody stools. For some complications, it includes edema, emaciations, loss of appetite, anemia, lobar, pneumonia, and malabsorption. For the laboratory diagnosis, we can see the finding of unexplained eosinophilia. We have also the concentration techniques. Harada Mori using the filter paper method or the entero test. Sometimes duodenal aspirate can be collected by the entero test. And Banner-Behrman funnel technique, Bell sting test, and again duodenal aspiration. Sa kaning Harada Mori filter kay paper tube method ni siya na technique. And then in disseminated infections, larvae may be found in sputum or in urine. For the treatment, even in asymptomatic stage, strongyloidiasis must be treated because of the potential for subsequent fetal hyperinfection. So, ivermectin 200 mg per kg daily for 2 days is more effective than albendazole 400 mg for 3 days. For disseminated strongyloidiasis, prolonged course of ivermectin should be given at least 5 to 7 days or until parasites are eradicated. So also mag-use punta of diabendazole given at 50 kg per body weight and 2 divided doses daily for 2 consecutive days after meals. So prevention and control, avoid walking barefoot, health education on personal, family, and community hygiene, and lastly, good environmental sanitation. Next, we have the hookworms, Necator americanus, and Ancylostoma duodenale. So, hookworm is the most important causes of IDA or iron deficiency anemia in both tropics and temperate countries. It is so named because the anterior end of the adult worm is bent like a hook. So, classification of hookworms belongs to the family Ancylostomidae, which consists of 2 species infecting humans. We have Ancylostoma duodenale and N. americanus. So, ang word na ancylostoma derived from the hook mouth ancylus, hooked, and then stoma, mouth. Muna ancylostoma. So, in human parasite, this is a human parasite, and then ang kaning N. americanus is also called as the New World hookworm, where ang kaning Ancylostoma duodenale kay ang Old World hookworm. So remember lang ang names, and then sa N. americanus Necator, new siya, NN. So let's proceed to the morphology of the adult worm. So adults are cylindrical with the head bent sharply backwards. So the size of the mealworm is smaller, um, 5 to 11 mm than the female, 9 to 13 mm. So ang color ani niya kay the adult worm kay color pink or grayish white, but it may look reddish due to the ingested blood. So species are mainly differentiated by their buccal capsule and the arrangement of rays in their bursa. And eggs are indistinguishable, which is ovoid with thin transparent shell measures from 60 um long to and 40 wide. So the common human species are Necator americanus and Anustoma duodenale. So N. americanus is mainly found in the Southeast Asia, Sub-Saharan Africa, tropical America, mainly in most tropical regions, while Ancylostoma duodenale is found in North India, North China, Middle East, Africa, mainly in drier and colder areas. So let's proceed to the N. americanus. So Necator americanus, the adults are small, cylindrical, fusiform, grayish-white nematodes. The female measures 9 to 11 mm by 0.35 mm and are larger than males. The male measures 5 to 9 mm by 0.30 mm. So the posterior end of the female has a broad caudal bursa with rib-like rays used for the copulation or mating. The buccal capsule has a ventral pair of semilunar cutting plates. The head is curved opposite to the curvature of the body which looks like a hook at the anterior end. For Ancylostoma duodenale, the adult is larger than N. americanus and there are single paired female and male reproductive organs. The shape of the adult is the head continuous in the same direction as the body curvature of the body, and the buccal capsule has two pairs of curved ventral teeth. So we have here the Ancylostoma duodenale and Necator americanus. So ang ilahang buccal capsule for Necator americanus, 4 chitinous cutting plate instead of teeth. Ang Ancylostoma duodenale na siya teeth, 6 kabuo. Ang buccal capsule nila kay ang kani kay sa dorsal ray kay split from the base. So diri pa lang nag-split na siya compared sa Ancylostoma duodenale na naadiri siya sa tip na ning split. And the spicules are free. Kakita mo ani na line, mo ni siya ang spicules, free siya compared ani kay nag-fuse na siya sa end. So mo ni siya ang copulatory bursa. Mo ni siya ang barrel-like expansion sa posterior end sa male worms bearing 2 spicules. Let's proceed to the larvae. There are 4 stages of hookworm larva, L1 to L4. And the first stage of larva is the rhabditiform larva. So the rhabditiform larva of N. americanus and A. duodenale are indistinguishable. So they resemble those of X. stercoralis, but they are larger and more attenuated posteriorly. So naatoy comparison sa katong S. stercoralis nato pag-discuss nato atong S. stercoralis. And they have long buccal cavity. So mo ni siya ang sa L1 or sa first stage sa rhabditiform larva. Next we have the L3 or the stage of larva, which is called filariform larva and is the infective form to man. So the buccal spheres of N. americanus filariform larva are conspicuous and parallel through their length. Filariform larvae of A. Ancylostoma duodenale are inconspicuous buccal spheres. So ang N. americanus conspicuous, ang A. duodenale kay inconspicuous. The filariform larva is the infective stage. Again, infection is by skin penetration through the exposed skin. So, rhabditiform larva di ay and filariform larva sa Edo, Denali, and Americanus is morphologically similar, but it differs sa morphology sa ilang filariform larva. So, we have here the differences sa Ancylostoma duodenale, Necator americanus. So, sa size kay large and thicker ang Ancylostoma duodenale, sa Necator americanus kay smaller and slender. Ang anterior kay mag-bend siya sa same direction sa body. If inga na, ang kaning anterior end opposite, meaning muliko ba siya. So for the buccal capsule, we have 6 large ventral cutting teeth sa Ancylostoma duodenale. Sa Necator americanus kay 4 cutting plates. So numbers of cupulatory bursa on 13, 14 sa Necator, tripartite, bipartite, partite, 2 separate spicules long and wrist-like, 2 spicules fused at the tip forming a delicate bark. So sa posterior and sa female kay C-shape mersiya ingana. And then ang sa S-shape na pod sa Necator kay mersiya ingana. Pathogenicity, more pathogenic to 25k to 30k eggs. Ang Necator americanus kay less pathogenic with 9k eggs. So, mo ni siya ang eggs sa N. americanus. So, they are oval or elliptical shape, measures 60 to UM, 40 UM wide with 2 to 8 blastomeres, resembling the Morula formation. So, mo ni siya. So, they resemble those of S. stercoralis eggs, but they are larger and more attenuated posteriorly. So we have here the life cycle involves only one host, the man. Infective form kay ang filariform larva. And then mode of transmission through the penetration of skin by the third stage of larva by walking barefoot in dampened soil. Now we have here the life cycle. So following penetration, the man gets infection with penetration of the skin by the L3 larva. It enters into the small subcutaneous venules and through venous circulation reach to the side of the heart and finally to the lungs. Here they enter into the alveolar space and migrate up to the bronchi and trachea and finally swallowed wing in the sputum and then enter the GIT. For the intestinal phase, we have here, it develops, the L3 larvae develops into adult and undergo the third molt, either in the migratory phase or in reaching to the esophagus, where they reach the small intestine and undergo the final molt to develop into adult worms. So the adult worms attach to the intestinal mucosa by the tip of their buccal capsule, and in about 5 months following infection, the adult worm matures. And then following fertilization, the worm starts laying eggs which are excreted in the feces. So a gravid female of Edo denali can lay 10,000 to 25,000 eggs per day, whereas N. americanus can lay 5,000 to 10,000 eggs per day. So the female bird survives for about 1 year sa Edo denali and then 3 to 5 years sa and Americanus. So, ari na ta sa development in the soil. Embryonation takes place in the moist or sandy or warm soil, and the first stage of rhabditiform larva hatch out from the eggs, which then molt twice. And finally, the infective stage, the L3 larva, which are developed within 5 to 8 days and remain viable in soil for several weeks. So we have here the pathogenesis, the effect of migration to the larval location in sensitized persons. So infective larvae may provoke pruritic macula, papular dermatitis, and rashes called ground itch at the site of the skin penetration. So, mo ni siya sa during the skin penetration, the larva can cause itchiness diri sa site sa entry. And then, larval migration to the lungs may cause pneumonitis and bronchitis. So, ang migrating larva through the lungs occasionally can cause mild transient pneumonitis and bronchitis, but the severity and frequency of lung manifestation is less rasha compared sa ascariasis. So in heavy infection, microcytic hyperchromic anemia is produced and hemorrhage of the site of attachment. Infective children are edematous, or called as protein losing enteropathy and Wakana disease. So ang kaning Wakana disease kay mao ni siya may tabo when ang katubit ng L3 na larva sa duodenale kay malamoy sa oral route. Pero both na gastrointestinal due to the larva develop sa due sa larva na mo develop into adult worm sa intestine, as well sa pulmonary symptoms due sa larva na migrate sa pharynx kay ma-observe. So, ang common symptoms include nausea, vomiting, pharyngeal irritation, cough, dyspnea, and hoarseness. So, this is not seen with N. americanus as their L3 stage fails to develop after ingestion. So, naara siya makitan sa endodenale. For the laboratory diagnosis, we have the finding of eggs in the feces, the stool microscopy. So, diri makadetect siya sa non-bind stale, stained oval, segmented eggs. So, the diagnosis is established by finding the characteristic of oval segmented hookworm eggs in feces. So, stool consecration procedures may be required to detect lighter infection. Eggs of duodenale and N. americanus are indistinguishable. So, in a stool sample that is not fresh, the eggs may hatch out to release rhabditiform larvae, which can be need to be differentiated from those with strongyloides. So, also, may-use na pod ang Hurada Mori filter paper tube method. So, a strip of filter paper, i-place sa test tube with water, allowing ang margate to migrate. If upward gani ang migration, strongyloides na siya. If padong downward, hookworm na siya. So, mo ni siya ang used to recover the identity of the larvae. Also, ang katong petri dish na culture stool kay ismear sa agar or nutrient media, and then if a larvae mo migrate upward, leaving the characteristic tracks which are then observed. So next we have the treatment. So we have the albendazole, mebendazole, 400 mg once, mebendazole 500 mg once. And if anemia is present, iron or folic acid should be given. So if na ay mild iron deficiency anemia. So for the prevention and control, interaction of three factors determine the epidemiology of infection: fecal soil contact, provisions of latrines and sanitary disposal of species, infective soil human contact, wearing of protective footwear, and cooking or washing vegetables, suitability of soil and climate for the development of eggs and larvae, destroying the larva in soil, health education, and mass chemotherapy. So, are na to sa itong last na parasite, which is the Trichinella spiralis. This causes trichinosis or trichinosis, which is a zoonotic infections acquired from the domestic pigs or other carnivores. So, Trichinella belongs to the class Adenophorea, superfamily Trichinolodea, and family Trichinellidae. For the habitat, adult worms lives deeply buried in the mucosa of the small intestine, particularly sa duodenum and jejunum of the bear, pig, rat, or man, and the encysted larvae are present in the striated muscles of the hosts, and there are no free living stages. Muscles, striated muscles. So we have here the adult worm. So the adult T. spiralis, it is small, whitish in color worm, just visible to the naked eye, and is one of the smallest nematodes infecting humans. The anterior half of the body is thin and pointed, ang anterior. Well adapted for burrowing to the mucosal epithelium. So the male worm is 1.5 to mm long, identified with the presence of the pair of copulatory organs at the tail end called as claspers. So mauni siya ang claspers. Pero di wala siya copulatory bursa. So the posterior end of the male has a pair of pear-shaped cusping papillae termed as claspers, and one of each side of the cloaca orifice that it uses to hold the female worm during mating. So the female worm is 3 mm long and has a single ovary, oviduct, seminal receptacle, a coiled uterus, vagina, vulva, producing 1,500 larvae or more in her lifetime. So they are viviparous. They directly lay egg, and there is no egg stage. So for the larva, again, there are 4 stages of larva in our Trichinella spiralis. The newborn larva, L1, which measures 80 m long. Its esophagus has a stylet, a spear organ that helps in entering into the cells. So inside a muscle, the larva usually coiled as a spear-like burrowing anterior tip. The infective L1 larva in muscles measures 1 mm long, and inside the muscle sees the larva remain coiled. Diba? Hence, the species name is given as spiralis. So we have here the pig is the optimum host and is the principal reservoir of the infection. And animals also like rats, horses, or other carnivores can also serve as the host. So here we have the life cycle. So the life cycle of Trichinella has two, the optimum host pig and the man. So Trichinella is a parasite that has a direct life cycle, which means it completes all stages of development in only one host, but only a single cycle occurs in one host for the continuation of the cycle and the maintenance of the species. So it is necessary for the infection to be transmitted to another host of the same species or of different species. So, infection can pass from pig to pig facilitated by the custom of feeding pigs with untreated household garbage, which may contain bits of pork with infective cyst. Also from rat to rat or pig to rat. So, man is the dead end of the parasite kay as the cyst in human muscles are dili man siya makaon og lain na host kay kinsa may mukaon og tao. So infective host kay encysted larva found in the muscles or of pigs and other animals. And the mode of transmission is that Mar acquires infection mainly by eating raw or undercooked pork or inadequately cooked pork. So encysted larva in muscles, ang infected stage, processed sausages or other meat products containing viable larvae. When such meat is eaten without adequate cooking, the cysts are digest by the gastric juices and viable larvae are released in the stomach, duodenum, and jejunum. Now, the life cycle of Trichinella spiralis. So, the intestinal phase, man acquires infection by ingestion of raw or undercooked pork containing the L1 larva. And then ingested L1 larvae are immediately freed from the animal flesh by the action of the digestive enzymes in the stomach. Then they are carried out to the small intestine, then penetrate to the intestinal mucosa where they undergo the molting to become adult in 2 to 3 days. The female worms lay L1 larvae and the male worms mate with females and the worm dies. So females again are viviparous and after 5 days of fertilization they start laying the first stage larva. For the migration phase, the L1 larva penetrate the intestine and enters the circulation. It penetrates the intestine and carried to the skeletal muscles via lymphatic and venous circulation. So for the encysment, the L1 larva enter inside the skeletal muscle cells and behave as an obligate intracellular anaerobic parasite. So the muscle cells are modified within 20 days to form nerve cells surrounded by blood cells which provide the required environment for the containment of the parasite for years. So only skeletal muscle cells are infected. Encysment doesn't occur in cardiac and smooth muscles. So same ra ni siya ang kuan po diri sa kaning animal or sa mga pig. Same ra siya o sa kaning man. Ang differences lang kay ang kaning sa pig kay mutuyok siya balik kay ang pig if kaning ang pig mamatay or ang larva sa pig na naa sa muscle sa pig makaon na pud balik sa animal. Pero ang sa diri sa man kay more siya gitawag na dead end ni ang man kay ang larvae or ang encystis larvae na naa sa striated muscle sa man kay dili naman siya makatuyo kay dili man siya makaon aw unless na lang if naay mukaon og tao muna kuan na siya. For the pathogenesis and clinical manifestation, severity of symptoms depend on the intensity of infection. 10 larvae are usually asymptomatic. 100 or more larvae show symptoms, and 1,000 or more larvae is severe and even fatal. So pathogenesis of trichinelosis depend on the phase of invasion, enteric invasion, the larval migration, and muscle encystment. So for enteric phase, we have the diarrheal, constipation, vomiting, abdominal cramps, malaise, and nausea. For invasion phase, we have fever, facial edema, urticaria, pain, swelling, and weakness. And for the convalescent phase, fever, weakness, pain, and other symptoms. In severe cases, we have the gastric and intestinal hemorrhages, myocardial and neurologic complications, pericardial effusions, congestive heart failure, meningitis, and meningoencephalitis, and cerebral lesions. For the laboratory diagnosis, we have the biochemical test may show chemical evidence of the muscle damage, high counts of peripheral blood eosinophilia to strengthen the diagnosis, and we have serology, ELISA, and the Bachman intradermal test. Also, we can use that. And the definitive diagnosis is the muscle biopsy. So, demonstration of larvae in the muscle biopsies by direct slide technique and H&E stain. So, for the treatment, thiabendazole 2 times a day for 7 days, mebendazole 6 hourly for 10 to 14 days, and we have albendazole. So also for the mild infection, symptomatic treatment is required with bed rest, antipyretics, and analgesic. For the moderate infection, mo na ni mag-use og mebendazole and bendazole. Okay, active siya against the enteric stages of the parasite. And for the severe infection, glucocorticoid is added, which is beneficial for the severe myositis and myocarditis. For the prevention and control, meat should be cooked at 77 degrees Celsius, freezing 15 degrees Celsius for 20 days or 30 degrees Celsius for 6 days. Meat inspection and keeping pigs in rat-free pens, and health education. So that would be all for this topic, the intestinal nematodes. And for the references, using essentials for medical parasitology, Paniker's textbook, and Belisario medical book in the Philippines. So thank you.